Good afternoon, everyone. Thanks everyone for staying. I know it's kind of hard when it's one of the last sessions of the day, but I appreciate everyone kind of hanging out and staying for this talk. I have been practicing small animal veterinarian for about the last 25 years, and during that time period, I have cultivated a significant interest in working with rabbits. I know I said that I do see other exotic species, some birds and pocket pets, but to be honest, anyone that works with me will tell you that really my heart belongs to the rabbits, and I would say that it's definitely the #1 exotic species that I treat. I have been working with the House Rabbit Society since I moved to San Diego about 10 years ago, and I'm happy to have joined their board of directors earlier this year. So we're going to spend about the next 45 minutes or so talking about some of the more common issues that we tend to see in our senior rabbits and kind of the ways that we manage them. Next slide. So just kind of a general overview. If you read in the literature, the average lifespan of the domestic rabbit is about 6 to 10 years. And I put more because, as most of us know, a lot of our rabbits are living much longer now, especially the smaller breeds. We'll see 12, 13, even all the way up to 15 years of age. So given that, most of us consider a senior rabbit to be when they hit about 5 years of age. And it's at this time period we usually will recommend semi-annual exams with a rabbit veterinarian. That way we can give them a complete examination, kind of nose to tail, so to speak, and we're looking at their eyes and looking at their teeth, listening to their heart, palpating their abdomen, trying to feel for masses, watching the way they move, looking for signs of arthritis. And it's kind of a way that we can sort of work with our clients as coming up with a plan, as they get into those golden years. It's also at this time period that we might start recommending annual blood work. Again, we're looking for some things you can't see on the outside, early signs of kidney disease or liver disease. If a rabbit is on regular medication, we might as well, we might recommend doing the lab work more frequently. Next slide, please. So the first condition I'll talk about is dental disease. This is, first of all, probably the #1 reason that clients will seek veterinary care for their rabbit, and it's hands down, as a veterinarian who sees a lot of senior rabbits, the #1 thing I treat these guys for. Just a kind of a quick overview, the rabbit dental formula is up there. And most of you guys probably know 2 sets of incisors on the top, 3 premolars, 3 molars for a total of 16 in the upper jaw. And then in the lower jaw, 1 set of incisors, 2 sets of premolars, 3 molars on either side, 12 in the lower jaw for a total of 28 teeth. For the most part, we generally tend to lump the premolars and molars together and just refer to them as cheek teeth. So that's kind of what I will do at this point, is just to kind of put them together. It makes it easier for discussion. The reason why we see so much issues with dental disease is that rabbit incisors and cheek teeth grow continuously throughout their lives. That therefore then, if there's any change in the way things are contacting each other, how they're eating, that can predispose them to dental issues. Next slide. So clinical signs typically of dental disease, decreased appetite and stool production. Obviously these guys sometimes are painful, so they don't want to eat as much. Selective feeding, maybe they don't want their favorite treat anymore, or they're refusing hay. Bruxism, that's just the medical term for teeth grinding. Tyolism, that's the medical term for drooling. Typically when we see these signs, we definitely know there's signs of pain, and it's usually associated with spurs that develop on the cheek teeth. That's what creates that. Weight loss, of course, if they're not eating as much or being more picky about their food, they're going to lose weight. Nasal and or eye discharge. Typically the reason why you'll see the eye discharge is it's due to obstruction of the nasolacrimal duct, usually from the roots of coming from the upper incisors of the upper premolars. And lastly, facial and or jaw swelling. Typically we'll talk about that can develop then from these dental issues. They can develop abscesses. Okay, next slide. And then I some pictures here to kind of show you, what we might typically see. You guys can kind of see eye discharge. You can see that typical loss of fur around the eye. The fur is typically matted with this sort of thick, milky discharge. That's typical for eye discharge we see with this. Next slide. And that's your classic look of a lower jaw abscess. Typically in a rabbit, if I have a rabbit come in that's got a swelling associated with the face or the jaw, one of the first things I'm going to be thinking is this is potentially an abscess associated with a problem with the teeth. Next slide. So causes of dental disease, certainly we can have genetics. We all have those rabbits that are born with maloccluded incisors, and that can definitely over time lead to issues with the cheek teeth as well. A poor diet, definitely if they don't have a lot of hay in their diet, or there's a higher incidence on high carbohydrate or solely pelleted diets. But probably what's believed to be the #1 reason why you might have a rabbit that's never had teeth problems, all its younger years, and then suddenly it's 5 or 6, and now all of a sudden it's starting to have some issues. Why is this happening? Most of us believe that it's secondary to metabolic bone disease, which is typically caused by a calcium or vitamin D deficiency. We call this syndrome, and I've written it up there, the progressive syndrome of acquired dental disease, or PSADD for short. And I'll kind of explain sort of how it works, is that metabolic bone disease typically causes an insufficient alveolar bone to support the teeth. So as the teeth continuously grow, the roots underneath the gum line start to elongate and curve. As that starts to happen, that leads to abnormal contact of the crowns and crown curvature. That then leads to spur formation of the cheek teeth. With time then, as this progresses as the roots are elongating and cause the crowns to curve, you're seeing spaces develop in between the teeth. Food gets impacted down in there. You get bacteria that gets into the alveolar bone. That's ultimately then what leads to these abscesses that we see on their jaw. Ultimately, in end-stage disease, actually the teeth will stop growing, and then they start to disintegrate and can literally break off at different rates. So that's kind of a general synopsis of why we start to see this as these guys get older. Next slide. So diagnosis, definitely one of the first things is we want to do a thorough exam by an experienced or qualified rabbit veterinarian. Now, as most of you know, rabbits cannot open their mouths very wide when they're awake. So although you might see us, we might do a cursory exam with you in the room. We might use a ear cone or some type of instrument to basically get behind the incisors and try to get a cursory look at what's going on. And in many cases, you can definitely tell that there's something. You see a lot of drool in there. It smells bad. You might see some of the points. But really, to get a really diagnostic look as to exactly what's going on, the level of disease, and formulate a treatment plan and chart what's going on in there so you can use that to follow up in the future, is really you need some level of sedation or anesthesia to really do this. The second thing we use are skull radiographs. Again, sedation or anesthesia usually needed to get diagnostic quality films. What we're looking for there, so on an exam, we're looking at the crowns, the teeth you can see, what's going on visibly. What we're looking for in x-rays is what's happening with the roots, and we're looking for this elongation of the roots, the curving. Are we starting to form abscesses? That's the goal of what a skull radiograph is going to tell you. Probably the most detailed imaging that you can get of teeth roots is with a CT scan. It allows you to really, sometimes you're questioning, you might have an abscess, and which tooth is the problem tooth. You can't really define that on an x-ray sometimes. So a CT scan can kind of give you a more definitive answer. However, they're costly, and they definitely require general anesthesia to do that. Next slide, please. So I kind of wanted to, I don't know if how many of you guys have actually been able to see. It's funny, I just the other day had the text, I was trying to do, working on a mouth, and I was trimming some teeth and pulling some loose molars. And I'm like, oh, what does it look like in there? Because it's such a small space. Literally only one person can be looking at a time. So this is kind of a good picture to sort of show you what we're looking at when we look inside their mouths. The bottom, kind of walk up here, The bottom here is the tongue, and there's the back of the throat. And then you can kind of see what we're looking at, see the normal side over there, what you might expect to see the cheek teeth to look like. And then as they develop these spurs on the upper jaw, they tend to form buccal, or what are called cheek spurs. That's where they tend to rub. And in the lower jaw, can you see these here? Are these sticking out? They'll form lingual spurs or tongue spurs. And so you can imagine looking at that as these poor guys are chewing, that's rubbing, against their cheek or their tongue, and it can be extremely painful. And again, that's why you're seeing the teeth grinding and the drooling. Next slide, please. This is then a picture of what a good skull radiograph would look like. This is a side view, and I kind of got the arrows pointing. If you guys can sort of appreciate that these roots underneath the gum line, so they're starting to elongate. They're all the way down, to the lower part of the skull there, and they're starting to curve. And so this is sort of the early signs that, we're starting to develop this condition, and we're going to start seeing some symptoms. Next slide, please. So treatment, these are, in all honesty, typically all done under general anesthesia. Again, extremely difficult, to get in there. You've got to, get some space to get instruments in there in your fingers so you can do some of these things. So they really have to be under general anesthesia so that we can stretch their, their jaw muscles a bit and get in there and do what we need to do. So the first part, as the crowns are growing long and curving, we're going to get in there and file those down and trim the spurs. We typically do that with a variable speed dental burr to make that happen. It's the most effective way, least traumatic way to accomplish that. If at that time period we notice that there are some loose teeth, we can extract them at the same time while we have them under anesthesia. Usually I find that most cases, once they start developing these points or spurs on their teeth, usually require some type of lifelong a treatment or trimming of this. And it really depends on the severity of the disease as to how often you might do this. I've had some cases as often as every 3 months, others that might go 6 months or even to a year in between, just depending on how quickly they become symptomatic. And then the last thing, a facial or jaw abscess. Surgical debridement is really the most successful approach to treating these. All involved teeth need to be extracted to prevent recurrence. 96% of these abscesses are caused by anaerobic bacteria. And so in addition to doing surgery, we'll oftentimes use injectable penicillin G on a daily or every other day basis for like 6 to 8 weeks, to help us get this under control. Next slide. So prevention is really, a good diet of grass hay to provide fiber and encourage normal chewing behavior. And then, again, getting back to that metabolic bone disease, regular sunlight exposure. Rabbits certainly take in plenty of calcium, but you got to have vitamin D to use that calcium. So regular sunlight exposure to improve vitamin D production and minimize the effects of metabolic bone disease. I typically recommend for my indoor rabbit clients that they get their rabbit out with supervised, time outside for at least 1 hour a week. I think that can be helpful. It's good for the rabbit to get some exercise, and then they're getting some vitamin D. Next slide. The next group we'll talk about will be cancer or neoplasia. Unfortunately, as we know, as you get older, these are things that can tend to happen. There are three, next slide, three main ones that probably I see on a regular basis. First one would be uterine adenocarcinoma. It's the most common cancer of intact female rabbits. Incidence is probably 50 to 80% in rabbits greater than 4 years of age. Clinical signs are typically bloody urine and or vaginal discharge. Diagnosis, relatively straightforward. Oftentimes on palpation, we can feel, a mass effect or enlarged uterus. Radiographs, typically on a normal rabbit, if you were to x-ray them, you won't see their uterus. So if you're seeing it, I would, be suspicious that something is going on. We're also looking for signs of metastasis to the lungs, before we proceed to surgery. And ultrasound, certainly abdominal ultrasound, would allow you to identify, an enlarged or abnormal uterus. Treatment, Ovarian hysterectomy is curative if the tumor is still contained within the uterus. So if you catch these early, you actually can cure them. These are typically slow-growing tumors that will eventually metastasize to the lungs, liver, and bones. So obviously, the earlier you find it, the better your chances for recovery. And prevention, spaying your rabbit in less than 2 years of age. I'm sure most of you guys recommend and encourage that, but always it's nice to remind people. I still, from time to time, will still have rabbits come in, and they're 5-6 years of age and they've never been spayed. It's always kind of surprising to me. Next slide. Here's just a picture from surgery removing a uterus with multiple nodular masses, kind of typical of what we might see when we do this. Next slide. Next one, mammary adenocarcinomas, clinical signs, an enlarged firm nodular mass in the mammary region. These can metastasize to lymph nodes, lungs, or other organs. Diagnosis, again, pretty straightforward. You're going to actually, feel these on the outside of the body, and then we might perform an aspirate with a needle and syringe and send it to the lab to confirm that it truly is neoplasia. And we want to make sure it's that before we're planning surgery. Treatment would be wide surgical excision of the mass, including the associated nipple. Again, you typically want to do chest x-rays before you do surgery just to make sure you don't already have metastasis. And prevention, it's believed that, again, spaying at a young age, less than 2 years, may decrease the risk of them developing this. Next slide. This last group in the cancer category, the literature says that this is not that common in rabbits, and maybe it's because most of the rabbits I see, have already been spayed and neutered. I feel like this is probably the most common cancer that I see. And that's this group of tumors that cause a cranial mediastinal mass effect. This is in the thorax. I will show you a picture of this in a little bit. Thymoma or thymic lymphoma. Thymomas come from the thymus. Thymic lymphomas from the lymph system. The clinical signs typically of this will be increased respiratory rate or they're in distress. Jugular distension, those are the veins in the neck, might suddenly be really noticeable. They're sticking out. Edema or swelling of the head through the front limbs. Probably this last one is one of the more common things I will see is exophthalmos, which is the medical term for bulging eyes, and typically you'll see it on both sides. Suddenly you're like, the rabbit just doesn't look quite right. You look down at it really from above and you can see that the eyes are kind of bulging out. That's not normal. So diagnosis would be chest x-rays. Again, I have a picture. I will show you what that looks like, but typically the mass will cause a caudo-dorsal displacement of the heart and elevation of the trachea. An ultrasound-guided aspirate or biopsy is really what you need to do to confirm the diagnosis. You obviously do want to make sure it is a tumor versus an abscess or something like that. The treatment, surgical excision of the mass is the best option. It is associated with a high amount of risk. You are talking general anesthesia and opening the chest to remove it. So, it's hard to find a surgeon, that would feel comfortable doing this and, with the high risk associated with it. So another option is localized radiation therapy that is starting to be done more and more, where it offers increased survival times. It's not going to, cure the situation, but it can slow down the growth and development of the tumor. These, for the most part, thymomas especially are considered to be histologically benign, but and they're slow growing, but they can be very locally invasive, and it's just the sheer size and location of them is what creates all the clinical signs. And prognosis honestly really is more dependent on how invasive they are than really the size of it. So next slide. So this I kind of want to show you. Can you guys appreciate this? Both eyes on this rabbit are bulging out, and essentially this is caused by the pressure created from the space occupying mass in the thorax. That's why they get this. Next slide. And this is what it might look like on an x-ray. Let's see if I can walk up here. You can kind of see that, you guys can appreciate in this, that you can't even really see, like this is the chest of the rabbit, and you can't even really see where the heart is. It's basically being completely displaced backwards, and the trachea way up there, just below the spine, which is not a normal location for it to be. So that's what we're looking for when we take x-rays. Next slide. The next group we'll talk about neurologic diseases. This kind of a couple things that we'll talk about, kind of put these together. Next slide. First one is encephalitizoan caniculi, or ecaniculi for short. This is definitely a common problem I see in rabbits as they get to be older. It is caused by an infection with a spore-forming intracellular parasite. It happens by ingestion of these spores in the urine, inhalation of spores from the environment, or crossing the placenta. A high percentage of rabbits out there are seropositive for ecaniculi on blood work. So the general belief is that they're exposed potentially at an earlier age, and then it develops into a latent infection. And then when these guys get older, or there's a really stressful event, then we start seeing the clinical symptoms. When the parasite does get in their system, it tends to, it can go to multiple organs, but it multiplies in the kidneys, and the spores are then excreted in the urine. I think there's a talk tomorrow on ecaniculi, so they can kind of go into a lot of specifics as well, but it is something I felt was important to address in the senior rabbit, because I do see a lot of problems with this. So the clinical signs are typically head tilt, circling. Nystagmus is when their eyes kind of flit back and forth. Hind limb weakness or ataxia, they're kind of off balance. They can have seizures, urinary incontinence, they sort of lose bladder control. Uveitis, which is an inflammation inside the eye, which ultimately can lead to cataract formation, and they'll go blind. The diagnosis, really the only true way to get a diagnosis is you'd have to do histopath on the brain or the kidneys. Not necessarily an easy thing to do in an alive rabbit. So typically what we do is a serum ELISA antibody testing on blood. And then C-reactive protein is another thing we'll do as part of the panel. It just adds some predictive value as to, do we have an active infection versus a more latent infection? Can we explain the symptoms, on an active ecaniculi infection? I tend to send my samples to the University of Miami. Everyone has different labs. There's lots of labs out there that do it now. But the University of Miami, I overnight it to them, and then I get it back within 24 hours after that, so it's nice if I need a result right away. Treatment of this involves typically using fenbendazole, or what you guys all know as Panicure, 20 mg/kg orally once a day for 30 days. What this does is it tends to, it's not a cure, and I have this on there, there's no treatment that will really cure this disease, but the hope is to stop the spore formation and reduce the clinical symptoms. So fenbendazole helps to do that for us. Minoxidil or Medicam or some version of that for its anti-inflammatory effect we oftentimes use as well. And then also a fluoroquinolone such as Baytril, it's an antibiotic as well, seems to have some effect at slowing down the reproduction of this organism. So you'll oftentimes, especially if we're not sure that's what we're dealing with and we're trying to figure out, we've got some, we're waiting on, results to come back, we might start them on this as well. But again, I'll state that there's, no real treatment for this disease. It's basically you're trying to slow down the spore formation and reduce the clinical signs. I'll just make one little side note. We talk a lot about using Panicure to treat this disease, and there's a small percentage of rabbits that can have a toxic reaction to these benzimidazoles, and it causes their bone marrows to kind of shut down and necrosis of their intestinal tract. And these guys can, suddenly stop eating, get really bad diarrhea, start hemorrhaging, sometimes no symptoms at all, and just will acutely die. So I always, try to, advise clients that, when we're going to be treating for this, I've usually done lab work at the start of treatment, checking for other things and making sure their kidney function is okay. But invariably, I will recommend a week after we start this treatment that they come in for a CBC and let me at least just make sure their white blood cells and red blood cells are handling this okay. Okay, next slide. So this is just an example, of your typical head tilt, sometimes at a point where they're actually rolling over. Next slide. And your classic example of some hind limb weakness that you'll oftentimes see with this disease. Okay, next slide. I grouped this kind of all together: osteoarthritis, degenerative disc disease, spondylosis, mostly because it's these kind of together cause similar symptoms. It's hard to differentiate them, and the treatment is all very similar. So clinical signs for this would be an abnormal gait, inability to hop, reluctance to move as much, splay leg syndrome. That's where you see, one or both front legs will be kind of off to the side and they can't seem to put them underneath them. Sway back, decreased appetite, especially if it's painful for them. Some aggressive behavior, oftentimes urine incontinence. They lose some ability with their bladder as well if they've got some back issues. Diagnosis, again, most importantly, will be clinical signs. This is when you come in and get your exam. We can see the way they're moving. We're looking for signs of that. X-rays, of course, we're looking for visible signs of arthritis or narrow disc spaces. And MRI is really the only way to truly or definitively diagnose disc compression. So I wouldn't say that I see a lot of that being done, but it is possible. You have to do anesthesia to do an MRI, and it is quite costly, but it's a way to really definitively define if it's a disc issue. Treatments typically for this would be non-steroidal anti-inflammatories. You guys already talked about meloxicam or meloxidil. Metacam is the brand name. Once to twice daily. Again, there's varying doses out there. Everyone has their different dose, but usually given once to twice daily on a long-term basis. I find most rabbits tolerate that very well. Polysulfated glycosaminoglycans, Adequan is the brand name for that. I tend to use a lot of that as well on my older bunnies. It's an intramuscular injection that for the first month, you typically do it twice a week. And if you are seeing a response, then you can maintain them on every 2 to 4 weeks as needed. Acupuncture, there's sort of new modalities that are coming out. Acupuncture as well can be really helpful to reduce pain. I didn't actually put it on my slide, but I forgot about it actually, but we do it. We have a laser, and now therapeutic laser is something that's being used more and more. It's non-invasive. Rabbits like it. It's quick and easy, and you can do that 2 or 3 times a week, and it can make a big difference with their pain. Did you have a question?
Yes. What do you think about chiropractic?
I just don't have as much experience with the chiropractic. I guess it's your opinion on, for yourself. For myself, I tend to use more acupuncture and laser type treatments, but I think there's a place for it. I think if truly there is some malalignment, along the back, then there can be a place for that. But I do think it should be, done by a veterinarian who's trained in that, for sure. You want to make sure that they know, their points and know what it is that they're doing. Okay, thank you. And then the last thing I put on there, stem cell therapy is starting to be talked a lot, with dogs and horses. And I'm hoping that at some point we might start seeing more of that with rabbits. But so far it has not really officially been approved for use in them yet. Okay, next slide. So this is the first picture of actually this splay leg is, I think it looks like it's all the legs seem to be involved. Splay leg is kind of one of those unusual kind of diseases that no one really has an exact handle as to exactly what causes this. I kind of lumped it with this group of arthritis because it tends to be something I'll see, and there's a congenital one or one that's developmental in young rabbits that you'll see it in the back legs, but in the rabbits over 5, it typically tends to be the front legs only. And we believe it's caused by a weakening of the muscles, and it may occur because of inactivity, potentially chronic discompression, which then can cause muscle atrophy, in the shoulders, and that can contribute to it. Possibly, housing on like a slippery floor or over a long period of time where the rabbits just can't get their legs under them on a regular basis. So it's a really frustrating disease to treat. I find that usually once they develop the actual legs splayed out, it's very difficult to get that to right itself and go back under them. But I do find that, again, some of these management, to treat pain, inflammation and that kind of stuff, it just helps the rabbits be more mobile and ultimately improve their quality of life, which is the goal of what we're trying to do. Next slide. And there's just a picture of what you might be looking for on x-rays, where you can kind of see this is the vertebral column there, and you can kind of see multiple bony bridges that are forming there. That's called spondylosis, a sign of arthritis, and potentially there are some areas that we might have some narrow disc spaces, again, that might be contributing to some of our symptoms. Next slide. Renal disease will be the next category we'll talk about. Next slide. First thing is urolithiasis. Again, with rabbits, the high pH of their urine combined with the high concentration of calcium in the urine favor formation of calcium carbonate precipitates or chalk. Clinical signs typically will be urine incontinence, urine scald, actually, of the perineal area. Visible chalk forms when the urine dries, and oftentimes it's painful for them to urinate. Diagnosis, often on palpation you can feel a firm bladder. It almost feels like a mass effect until you go to squeeze it, and then urine will come out. Radiographs will show sludge or actual stones in the bladder. Urinalysis will indicate that there's calcium carbonate crystals. That's typically what they form. You also want to do a culture and sensitivity of the urine just to make sure there's no secondary bacterial infections. Treatment is typically fluid diuresis. Again, this gets at subcutaneous fluids, can be administered at home. In the early stages, when they're really symptomatic, I'll have you do sub-Q fluids on a once-a-day basis until the symptoms calm down, and then you can kind of maintain them at once or twice a week. Meloxicam or minoxidil to reduce pain in the acute phases of it. Antibiotics are indicated if severe urine scald or urinary tract infection is present. If stones have actually developed, enough of this precipitate can kind of coalesce together and actually form a stone. So if they're present, you need to surgically remove those. And then actually manually expressing the bladder sludge. Sometimes these guys are really painful to urinate and they won't fully empty their bladder. And so it helps to actually, when I see them on exams, express the bladder, try to get as much of that material out as you can just to help them out. And prevention. Reducing calcium in the diet. Now, in the past, I've always recommended to limit or eliminate pellets, but I will tell you that I am learning myself. There are, more, companies out there producing rabbit pellets and food, and I know there's some vendors upstairs that, are doing some stuff with foods nowadays that sometimes some of the pellets are designed to help reduce the. You have a question?
Yeah, do you really think that diet has a huge impact on sludge and calcium and all that?
Do I personally? No. No. I think it's a factor, but I don't think it's the biggest factor. I really rarely don't focus that much on the diet, when I see these. I might, if they're big pellet eaters, I might back off on the pellets just to encourage them to eat more hay and greens. But no, I don't think that diet is the sole factor in this. To be honest, I think one of the other big prevention is you absolutely have to increase water intake in these guys. And that's really a big thing that I push. When you're giving the greens to these, to rabbits, you want to wash them and don't dry them off. Just give it to them soaking wet. So it encourages them to drink more water and actually exercise. I think really encouraging them to move and exercise more, not only will it encourage more water consumption, but it also helps them, stimulate them to, to urinate more often. So I think exercise plays a big factor in this. I think there's a lot of questions as to why exactly rabbits seem to be predisposed to this. And, the food companies will say, well, their diet is better than another, that it might help minimize it. I think every little thing can help, but the goal is that if you, and it's funny, you can have rabbits in the same household eating the same food, and one rabbit will have it and the other won't. So how can you explain that, But it's just differences in their metabolism and difference maybe in how much they drink water, I think can play a big factor in this. Next slide, please. So these are just some pictures. This is your typical urine chalk, so to speak, that, this is the urine when it dries on the towel. Next slide. Typical urine scald. These are very, very painful for these guys. You can see the redness of the skin and the fur gets really matted, with the urine. So when we see these, we usually recommend clipping the fur, bathing the skin with a mild soap, and then applying like either Silvadene or Desitin, something out of a medicated cream just to, help soothe it and make it feel better. Next slide. And that's kind of a cool picture of you actually seeing, you see that's the bladder there that's lighting up like that, and that's just really opaque substance that's completely filling up that bladder. That's typical with what you'll see with urolithiasis. Okay, next slide. And then actually degenerative renal failure. This is, where the kidneys start to fail on these guys as they get older. Clinical signs, lethargy, decreased appetite, weight loss, increased water consumption and urination. You can get dehydrated from that. Again, urine scald is possible if they're urinating more than they used to. Diagnosis really on this, you can't tell from the outside. It's really going to be lab work. You're looking for an elevated blood urea nitrogen and creatinine on our lab work. That's why we're recommending that we check these on at least a once-a-year basis. Elevated calcium and phosphorus, possibly non-regenerative anemia. The urinalysis will indicate that the urine's not very well concentrated. There might be protein in casts. Again, do a urine culture just to make sure that you're ruling out a urinary tract infection. But I'll stress again, one of the most common things that I'll see underlying kidney disease in these guys is this E. caniculi. So almost always, if I suspect it, we'll screen and treat them if they're positive. And treatment, fluid diuresis. If they have really high numbers, I might keep them in the hospital for a few days and do intravenous fluids, and then home management with sub-Qs. Antibiotics, if an infection, and the fenbendazole or Panacur if they have E. caniculi. Go ahead.
How reliable is the testing for EC? Because I've heard, I think my own that you can easily get a false positive or even a false negative. How can you rely on that as because of accurate diagnosis?
And that's a good question, and I don't want to take too much away from, I know there's going to be a talk on it tomorrow, but I found the lab that I use, University of Miami, I mean, it's not a definitive. You have to use a multitude of things. First, are the symptoms there? Does it make sense? You're looking for high antibody and antigen levels. The C-reactive protein that I mentioned is part of the panel that I do at the University of Miami. All these things together, kind of, they look at how high the actual titers are, if the C-reactive protein is high as well, if the clinical signs, go along with it. And then you use all that to decide, because you're right, so many rabbits will test positive for this disease. And, is it having active infection, or is it just latent and it has nothing to do with their clinical signs? But the higher the titers, the more likely, and the higher the C-reactive protein and the higher the titers, the more likely that their symptoms are related to an active infection. And you can also, recommend, you can 2 to 4 weeks after your first titer, you can retest them. And if there's a change, then you have a pretty good idea that you have some type of infection going on, whether it goes up or down. The fact that it's changing tells you the body's reacting to something. But yes, unfortunately, it would be great if they could come up with a way to test the urine when they're actively, secreting the spores. But so far, they haven't come up with anything like that. So we do the best that we can with the information and try to use that with our clinical signs to, decide if really their symptoms can be explained by that. Okay, and the last slide. And the last thing, and I'll be honest, I don't honestly see a lot of cardiovascular disease in rabbits, but it certainly is possible. Congestive heart failure can occur. The clinical signs are typical for other animals where they're, pale mucous membrane color, it can increased or labored respiration, not eating well, fainting episodes. I kind of put up here what the normal heart rate, and respiration rate for a rabbit would be. So if there's dramatic increases in that might, let you know that something is up. Diagnosis, auscultation, we'll use our stethoscope and listen, for signs of a heart murmur or signs of fluid in the lungs. X-rays would reveal an enlarged heart or potentially pulmonary edema or effusion, which is fluid in the lungs. And then echocardiography or a cardiac ultrasound is really the most, definitive diagnostic way to determine if they have congestive heart failure. There are definitely some treatment options. There's medication that you can use, but as a general rule, unfortunately, prognosis for this is not great. I mean, it's just we haven't really come a long way yet with, how to treat heart failure in these guys, unfortunately. So that's. Can I take some questions? Yep. So that's it. Hopefully that's a good summary.
Maybe one or two.
Okay. Go ahead.
What's the oldest you would spay or neuter a healthy rabbit?
I don't think I have an age. I mean, if truly they're healthy, so if a rabbit is over 4 or 5, I'm going to want to do lab work first, and make sure that, metabolically everything's okay. But if they really don't have any other health issues, there isn't any reason why you couldn't spay a rabbit at 6 or 7 or even 10. I mean, realistically. And sometimes you're forced to if they have, suddenly signs of uterine cancer. Well, what do it's your option is, they're either going to die from the cancer or you go in and you do the surgery. So I don't feel like I use an age as a definitive time to say I won't do it. I mean, we anesthetize rabbits all the time that are 10 to do dental disease. So what's the difference? If I'm going to anesthetize to do that, I can certainly anesthetize to spay them. So I wouldn't use age. Age is not a limiting factor. It's the health of the rabbit. Way back there?
So for the vitamin D, the sun hits the skin to make the vitamin D.
Yes. I can't.
How does it get through the fur?
Oh, it does. I mean, it's able to get through the fur. I mean, through their ears and through absolutely. I mean, they definitely are stimulated by natural vitamin D. There's no question about that. And through their nose, when you think of the different areas. One more, is that it?
That's it.
Okay.
Sorry. Keep us
All right.
on track.
All right. Okay, guys, thank you very much. Hopefully that was a